Most of our patients call because they're having some issue, whether it be decreased libido, erectile dysfunction, decreased energy, mental clarity can sometimes decrease, just going to the gym and not seeing many results, so they get discouraged and they start doing their research, and this is where we step in.
You know, when guys first get to Anti-Aging Clinic for Men, the first thing we do is run a lab panel on them and check their testosterone level, estrogen level, and various other hormone levels, in addition to their serum chemistries and renal function, liver function, that sort of thing. And the patient comes back after that lab work returns, which is usually 3 to 4 days, and they'll sit down with either me or my partner, Dr. Adams, and we'll go through their lab work and design a testosterone plan that's specific for them.
Once we have the initial lab panel, or our baseline panel, Mike or myself like to speak with the patients, okay? And this usually takes about 15 minutes. We tell the patients what we're looking for, what we found, and then we give them some options as far as trying to solve their problems. Treatment can come in many forms. We have creams, gels that you can put on your skin, and the testosterone itself is absorbed through the skin. We have intramuscular injections, which is the most common way to get testosterone. We also have pellets, implantable pellets. Now, the difference between all these, creams are more of a daily application. Intramuscular injections are usually once a week, and pellets can last up to 3 or 4 months.
The injections are given intramuscularly. We typically give them just in the butt muscle. It's given through a tiny 25 gauge needle, which, you know, guys ask me all the time, does it hurt? I give myself the injections, you know, I mean, they're not painful really at all. We typically give them 1 time per week, so guys just pick what day of the week they want to get their shot, and they can give them to themselves if they want to. You know, we teach guys how to do that all the time, whether they give it to themselves or maybe their wife gives it to them, but we can set them up with the supplies, and they can do it themselves at home, or they can come, you know, once a week here at the clinic, and they're here 10 or 15 minutes and get their injection, and they're out the door for the week.
I use the intramuscular method. I have a shot every week. I try to keep it on the same day of the week every week. I definitely can tell an increase in muscle mass. My energy levels are much higher, and I don't know, when they always said, you know, decreased sense of well-being, it improved that, I really didn't understand what they meant, but and it's still hard for me to put my finger on it, but I do feel like, you know, just things in general are better when I'm on it. And so it's been good for me. I feel much better, just overall.
The way we price our testosterone plan is it's kind of like a gym membership, really. You know, you come in and you're going to get your initial lab work, and you're going to pay for that. That's outside of the plan, because we don't know whether or not you're going to be a customer or not at that point. You know, so you'll pay for that, and then once you're in the plan, you're going to pay $150 a month, and what that covers all of your testosterone, all of your lab work, as many visits here that are as necessary. If you have a problem, you'll sit down with me or Dr. Adams at any time, and, you know, we'll be available to you at any time. And, you know, if you decide to do the injections at home, we set you up with all the supplies that you would be using here. Same deal. We give you the needles, the syringes, everything. You know, I think what sets our clinic apart from other ones that do testosterone supplementation is you get a lot more personal service. You know, it's a very nice facility. I think people like coming. They like the people that we have working here. It's easy. You're in quick, you're out quick. You know, we take good care of you. We watch your lab work very closely. You know, testosterone is safe as long as you use it responsibly. You know, it's a tool. I mean, just like Tylenol. You know, if you take 2 Tylenol, your headache goes away. If you take too much Tylenol, it can kill you. And, you know, testosterone's no different. If you use it irresponsibly, you can get yourself in trouble doing it. So you need to come somewhere that's going to do it responsibly. You know, we are trying to get people healthy by giving them a responsible dose of testosterone. You know, this is not a muscle building clinic, and we have patients that come here that want that. We absolutely do not do that here. You know, if you're interested in getting more healthy, you know, and getting the real beneficial aspects of testosterone, then this is the clinic for you.